right? So to first to understand how a preterm baby behaves, it's quite different from a term baby, right? Because they should be still inside the mother's womb, but they have come out quite early, so they need their time to grow. So first of all, what I'll say to all the mothers, don't hurry up, okay? Don't listen to what other people are saying to you, okay? Because every baby is a different baby. They gain weight in different ways, they get weight in different at different rate, right? But ultimately they catch up. So first thing I'll tell you is that all the premature babies, they become as healthy as a normal baby, but that will take some time. In some baby it might be 6 months, in some baby it might be 10 months, but by the end of 2 year, I assure you, for all the babies, even for those who are 1.5 kg or 2 kgs at birth, they will become as healthy as the babies, their counterparts who were born at full term and were 2.5 to 3 kg weight. So they will become equal by the end of 2 years, right? Provided they are given proper nutrition, proper care as told by your pediatrician. So that's very important thing. So don't worry, they will catch up first of all. Second, we always have some doubts in our mind whether our baby is gaining good weight or not, whether our baby is developing good or not, whether the milestones are not accordingly or not, right? So for all these things, what I always tell my parents, my patients, that when you go to a pediatrician, always always have a regular checkup, always go for the vaccination to a pediatrician and ask about all your queries, right? So in that way, proper milestones can be documented, any delay can be found earlier, and that can be addressed too. So it's very important in preterm babies that a proper follow-up has to be done, especially initial 3 or 4 months, I'll say. It's very important to get them regular checkup after every week, sometimes every 2 weeks, and sometimes once in a month. So why I'm saying this? Because weight gain is very important part of the newborn babies for all, for preterm also, for term baby also. So if there is any faltering in the weight gain, we can correct that only if we will catch it. Okay, so that's why proper follow-up is very important. Just a few basic things, that in the first few weeks, all the babies lose weight. That's quite common. If a baby born 3 kg, he will lose 300 grams weight for definitely in first 7 days, and then again start gaining the same weight. So the birth weight will be there after 14 days. So all the babies, they lose their weight initial 7 days. So there is nothing to worry about. It's common. It's a natural process, and they again gain the same weight for next 7 days. So the birth weight will be attained at 14 days of life. So it's normal thing. So don't worry about it. And we have to be very careful while taking care of premature babies. As far as their diet is concerned, their supplements are concerned, they have to be started at appropriate time, and they have to be given for that much amount of time. Like some are for 1 year, some are for 1.5 years, some are for 30 days. So they have to be given accordingly as per the weight of baby, as per the gestation of baby. Secondly, some babies who are quite very low birth weight, like 1.5 kg, even less than that, or those born quite quite early, like before 34 weeks. So if a doctor or your hospital in which you are born and they're asking you to keep a baby for 7 days, then you have to keep a baby there for some time. Because why we say that? Because if we send the baby early home, in that case the babies might get infections also. So that's why always follow the doctor advice. Whatever they are saying, just follow them properly, wholeheartedly, and believe me, your babies will definitely gain weight accordingly, and they will be healthy, right? So that's how we can just summarize it in a nutshell, right? So proper follow, proper care is very important for all the babies, be it a preterm baby or a term baby. And don't worry, by the end of 2 years, your baby will be as healthy as the the other babies of other counterpart babies, right? So don't worry. And as much as possible, it's very important to give breastfeeding if possible, right? That's the best thing to give to a baby. Okay, so this is how we can summarize it. Okay, now we can take up the questions, right? So the first is, what are the factors that will help me understand whether my baby is gaining adequate weight? Right, very nice. Okay, so what I have told you, that first initial 7 days, all babies will lose weight. That's quite normal. So after 7th day, they start gaining weight. So what happens when a mother is breastfeeding a baby? So she will feel lightness in her breast after breastfeeding. That's the first sign. Second thing, after feeding baby will be quite comfortable and can sleep for 1 to 2 hours quite easily. Right. Third thing, if a baby is passing urine 6 to 8 times in a day, that means baby is adequately fed, right? And other things is that normally the weight gain of a preterm baby is around 25 to 30 grams per day after 7 days of life, right? So in that way, by the end of 1 week, a baby should gain at least 150 grams to 200 grams of weight. So whenever you go to a pediatrician, he will definitely check your weight. So then you can compare whether the baby was 2 kg earlier and this time after 1 week it is 2.75, 2.17 or 2.50, then it's fine. But if a 2 kg baby has only gained like 80 grams weight, 60 gram weight, or less than 100 gram weight in 7 days, then it's allowed. Then we have to address the issue. So this is how we can differentiate. So one more question is there. My baby is delivered in 8th month, very weak. How can I help him gain weight appropriately? Okay, the first important advice will be patient. Okay, it will take some time. Baby will gain weight, and it will happen eventually, right? So don't hurry up for the thing. Keep on breastfeeding. The first thing is that's very important, as much as possible. Secondly, make your diet a healthy diet. By healthy, I mean you don't have to eat dalia, dal, and fishy whole 6 months of your life. You can eat anything and everything you want. The most important thing is don't eat too much oily things. Don't eat too much spicy food, but eat good protein food. If you are non-veg, you can eat non-veg. You can eat fish. If you are vegetarian, lots of sprouts, paneer, and everything. Right. So good protein diet is very important. So make sure you're not eating only that bland food. Eat everything. You can eat paranthas also. You can eat pakoras also. That's fine from my side, but they should not be too spicy and they should not be quite deep fried. Okay, so next question is, my baby was delivered prematurely by C-section. My breast milk supply isn't enough. How can I manage this and help my baby? Okay, fine. So never, what happens, the feeding, that all depends on psychological, right? It's a process that starts here. Your baby cries, baby asks for milk, your breast, they start producing milk and they get produced, right? This is how it is done. So if you feel, no, I'm not producing much milk, so it will give a negative feedback. So I always say, never think like that. Okay, always be positive, keep on trying, and again the same thing as I told you about the weight gain part. So exclusively breastfeed your babies for initial 7 days. Check the weight gain. If it is adequate weight gain is there, then your milk supply is also good. If weight gain is not adequate, then yeah, we might think of adding some supplements or some other things, that only after consulting with your pediatrician. Otherwise, don't start by yourself like cow milk and all these things. Never ever. Okay, never ever. And keep a good diet. That's again the same thing I'll tell you. Okay, so the weight gain can easily be maintained, but with a proper your diet also and proper milk production, that can be decided by the weight of the baby. Yes, and yeah, few more things like how we can see if the baby, I already told you, like baby is passing urine 8 to 10 times in a day, that means baby is getting good milk. Okay, next question is, my baby is 20 days old and was delivered prematurely. He is unable to latch properly and feed. How can I manage this? Right. So what happens? Normally the position we are preferring for the breastfeeding, it should be comfortable for both, for mother also and for the baby also. If you are not comfortable while feeding, so don't expect your baby is comfortable while feeding. So you should be having a reclining chair, and your baby will be. Once you go to there's a few WHO guidelines for that. You can clearly see that the pictures are there for that. You can see them how the mother is breastfeeding. So it's quite comfortable position. Baby should be in a comfortable. Yeah, you should not be making adjustment and positions while feeding a baby. If you're doing that, that means your position is not correct, right? So but sometimes those babies who are quite premature, less than 36 weeks or less than 34 weeks, they might have difficulty in latching because they don't know how to latch. So for them, what I say, you can express your milk, give it by katori and spoon, and then again you can put the baby on breast, so that baby will keep on learning how to latch on the breast. So eventually baby will learn. And never ever just when the baby is most hungry, the baby will give you cues. Okay, what are those cues? Baby will take his or her tongue in and out. Right? This is the first sign. Then baby will do this second sign, and then baby will start doing like that. This is the third sign, and the fourth sign is frustration. We will start crying. So these are the stages when baby asks for milk. So if you catch a baby in the first 3 stages, right, that with the tongue, that sound, and then eating his or her hand, in those 3 stages, if you catch a baby at that point and you latch to your breast, then baby happily suck. If the baby is like more than 2 kgs or more than 36 weeks. But if you are catching a baby at that 4th stage, like crying stage, then yeah, baby get frustrated and they don't latch that quite easily. But eventually they latch. Okay, it's not that they will not latch. They will. So this is how you can try the latching part. Okay, any other questions? Fine. So normally, so there are no fine. No question is there. Besides breastfeeding, what are the other factors that will help my baby gain healthy diet? Right. That's very important question. Okay. So all the preterm babies and all the low birth weight babies, it's very important that they should be provided with kangaroo mother care. That is KMC. Right. What happened? Because of babies with low birth weight, they have very less fat in their body. And in the temperature regulation, most of the babies, they lose lots of energy, so the weight gain decreases. So what we say, all those babies less than 2 kg or less than 1.5 kg delivered before 36 weeks of life, 36 week gestation, they should be given KMC. Now you must be thinking, what is KMC? KMC is kangaroo mother care, as the name suggests, kangaroo. So how the kangaroo keeps her baby, inside a womb, that pouch outside. So the same thing is we have to do. We have to keep our baby on our bare chest, right? Suppose this is the baby. Okay, baby should be like this on our chest, with both hands like this, and the mother should be like in a comfortable position, and this should be skin to skin contact. And then you can take a small cloth or a thin cloth, and you can just cover a baby. So in that way, you are providing good warmth to your baby, and the energy baby will expend in, maintaining temperature, that will be preserved. So the baby's weight gain will increase quite fast. Believe me, you might be thinking why I'm what I'm telling you, but this is a thing we have seen. It works wonder. We used to give it in our hospital when I work in RML, and it worked wonders. So it really helps. So keep on giving that particular, that care. That's very important. So in a nutshell, again, I'll tell you a few basic things. What are very important factors when we can see there is a good weight gain of babies getting adequate feed. So baby passing urine 8 to 10 times in a day. Baby sleeping 10 to 16 hours in a day. Okay, baby asking for milk without reaching the fourth stage of crying, right? And baby playing, making sounds. These are all, and passing stool sometimes 8 to 10 times in a day, sometimes once in a 4 day. Both are normal. So in this particular range, right? So all these things if baby are doing, that means baby is normal and gaining good. So proper pediatric follow-up is very important for preterm babies, because we need to add lots of supplement according to the weight of the babies, maybe it iron or a multivitamin or a calcium or vitamin D3, that too for the particular time period which is decided as per the baby weight gain, baby's gestation, and baby's birth weight. So keep a proper regular checkup, get your vaccination properly at time, especially for preterm babies, very very important. So, and as far as other milk powders and other things are concerned, don't start them by your own. Don't start any other milk like cow milk, buffalo milk, goat milk, unless your doctor tells you to use any other formula. Keep on using breast milk only, because that's the best milk for the baby, and it really helps to make the immunity of the baby, for the weight gain of baby, and everything, right? So it's very important. So take away message, I'll say, keep on breastfeeding, and also just be happy, enjoy the life, enjoy your motherhood, and don't get stressed about it, right? So if you need to contact me, you can follow me on Baby Chuck. You can also contact me. Once you search my name, you'll get the address. Also, you can come. You can come if you want to visit. You can come to Ayushman Hospital or at my clinic in Delhi. Right? Any other question, you can drop it on the Baby Chuck. I'll be happy to answer all your questions. Right? I hope I have helped you. And if any other queries, I'll definitely help you out. Okay. Take care.